I don't know what's going on here. From day to day, I don't know. You know, there are times my feet hurt so bad that I think I'm going to end up somehow like I don't know how I'm going to live if I can't walk. There's so many times that I can't walk because it feels like I'm walking on broken bones. And there are times that I can't walk from one room to the next because it hurts so bad. And and then there are times that my feet don't hurt. There are times that I don't understand what's going on here. Like there are times that my sinus pain is so bad it I just I'm almost ready to give up. That I'm in front of doctors and saying I can't do this. And then there are times it doesn't hurt. They've suggested there's nerve damage in my sinuses. I don't know. Last night, everything, all my joints and like my everything from head to toe hurts so bad. And I'm laying there like there are moments of just sheer panic. I'm laying there. I've got all my props. I've got my arms and legs propped up with support with pillows, a cervical collar on, the CPAP on, and I'm in so much pain and I'm so trapped that there are moments of panic that I can't do this anymore. Like I need out of this body now. Just sheer panic. Like I can't be in this body. I don't get it. I don't get anything in what's going on here. I don't understand any of this. There are times it's so hard to breathe and my arms and legs are just dead weight. No, most of the time. Most of the time the dead weight, which I think is motor nerve damage in my arms and legs. But I think there are moments that it's not severe. I don't know. You know, neuropathy, nerve damage is a really under talked about disease. And usually, like I'd never heard of this my entire life until I got it, until I was diagnosed with it. I've never heard of neuropathy. And it's a weird disease and it's chronic pain and it can come and go. And, but I guess, I guess if someone told me that this is all Chiari. If a doctor sat and heard my story for a couple hours, 2 hours of listening to my history, um, if he told me this was Chiari, then that would make sense to me, because every Chiari patient is different, and all of this could be Chiari. And then BIND, benzo-induced neurological damage, and all the damage that happened to me from these medication injuries. I don't know. You know what? I'm 7 years away from 7 years post injury. And I don't know. Do you see other people this 6, 7 years later? Like I'm disabled. But you know what? I have to keep reminding myself prior to this injury, these medication injuries almost killed me. They almost took my life. And prior to that, my life was already 95% gone because I I didn't sleep. I couldn't breathe efficiently, undiagnosed sleep apnea, long-term critically sleep deprived. My life was already gone. Other than coming and going and getting food and going for walks, my life just is totally gone. For years before that. Not from depression. No depression. Not from, like just trying to figure out what's medically wrong. I've been on CPAP 6 years. There's no reason the nights should be hell and so sleep deprived and so ill while I'm asleep. There's no, like the sleep apnea scenario doesn't make sense. If I've been on treatment for CPAP for 6 years, I don't understand just the severe suffering. I've got a virus right now. I've got a sinus infection. I started antibiotics yesterday or the day before. Just the pressure in my head. I got a virus that's just kicking my butt right now. But you know what? 365 days a year, I'm sick. And I don't get it. I do not understand. I'm in so much pain right now, which I assume is nerve damage just from head to toe. Don't understand how people can be so sick with no relief, right? And I can't really do drugs, and that's the world we're living in. Most people can take drugs, prescribed drugs, and I can't. And I used to be so confused in all these groups, and I'm just screaming for help, and everyone's saying, "Yeah, me too, but they're not screaming for help. It used to confuse me for a few years, and then I realized most of these people are sleeping, and most of these people are on a collection of medications. And if I could take medications and not have an issue, I would probably be managing like they are, suffering but managing. And sleep is the difference between. I mean, you got someone with a medical condition, whatever that might be, EDS, heart disease, cancer, a Chiari, it doesn't matter. You got one person that's sleeping and one person who's not sleeping. Who's going to be doing way worse? Who's going to be begging and crying for help when you got a heart patient that's sleeping 2 hours a night and a heart patient that's sleeping 8 hours a night? Who do you think is going to be begging for help, suffering, or looking crazy, desperate? I don't understand. I had like 4.5 hours of sleep last night, which is not enough. I don't understand what's going on here. Just suffering so bad, and the isolation. Yeah, I can't believe I haven't lost my mind, like gone crazy from the isolation. It's almost 8 o'clock. It's dark out. It snowed. I'm gonna see if I can go for a walk. If it's too slippery, if what kind of strength I have, how bad my feet hurt.